Hello, welcome to the University of California, San Diego Chronic Kidney Disease Program. My name is Norma Regev, and I am a licensed clinical social worker. Our healthcare team includes a nephrologist, pharmacist, nurse, social worker, and a dietitian. My role is to help educate patients learn about kidney disease and the treatment options available to them. This is one module of a 6-part series discussing treatment options for failing kidneys. In this module, I will talk about kidney transplant. Our goal is to help empower you with knowledge to make informed decisions about your kidney treatment choices. Kidney transplantation is one of those options. A kidney transplant is when you receive a healthy kidney from another person. This can be done through a deceased donor or a living donor. Not everyone is a candidate for a kidney transplant, but your doctor will let you know if this is a good option. The transplant team will need to do a full evaluation to make sure a transplant is right for you. There are 2 types of donors. The first type is a deceased donor. This is from a person who has died and donated a kidney. To get a deceased donor kidney, you will be placed on a waiting list once you have been cleared for a transplant. It can take many years for a good donor kidney to be offered to you. From the time you go onto the list until a kidney is found, you may have to be on some type of dialysis treatment. The second type is a living donor. A living donor kidney transplant usually involves a donated kidney from someone you know, like a family member, friend, or coworker. Genetically related family members are most likely to be compatible donors. It may also be someone you don't know, a non-related living kidney donor. Getting a kidney transplant from a living donor can happen faster, and it may function better. A kidney from a living donor may last longer than one from a deceased donor. Let's turn our attention to immunosuppressants. Immunosuppressants are drugs or medicines that lower the body's ability to reject a transplanted organ. Another term for these drugs is anti-rejection drugs. There are 2 types of immunosuppressants: induction drugs, which are powerful anti-rejection medicines used at the time of transplant, and the other is maintenance drugs, which are anti-rejection medications used for the long term. You will have to take long-term anti-rejection maintenance drugs for the rest of your life. Here is Gabriela Temores, a kidney transplant patient.
Well, my experience of receiving a kidney transplant was amazing. It gave me a second chance in life. I was able to get my health back and have my energy, also with the care of the doctors, and they reassured me through the whole process. I mean, it was amazing.
What have been some of the difficulties leading up to your transplant?
From being healthy and to then getting the news of stage 4 kidney disease. Um, it was hard for me in the beginning to realize that I needed a transplant. Luckily, I had great doctors and a good support system that got through the process. I looked at my options, if it was through dialysis or if I would get that transplant. From there, I went into the transplant once I knew my kidney function wasn't high anymore. I again didn't want to go into dialysis, so it was also the timing with the doctors, knowing how much of my kidney function we can continue preserving until then I needed the transplant so I wouldn't go on dialysis. Luckily, for me, I didn't have to go on dialysis. So the timing, again, working with the doctors and taking care of myself was great.
What have been some of the difficulties you didn't expect after your transplant?
I think one of the difficulties that I didn't expect was the recovery process. I had spoken to other recipients or other people that you would instantly feel better. That wasn't the case for me. I needed my body to be able to recover and I needed to be patient. Yes, it took about 6 weeks, and I finally felt different. I felt that energy coming back. Also, I didn't expect to feel some remorse, a remorse that as a recipient, this is where that remorse that I had somebody else's kidney, and now I had to be an advocate and take care of my health and take care of that kidney. Um, Again, exercise, eat healthy. Yes, instantly there was things a limit on my diet before the transplant. So of course you want to indulge in those foods that you weren't able to consume. But I knew I had a responsibility to take care of the gift and the blessing I received, and um and be my advocate if it's for my health, to be able to know that it's not an easy process leading up to it, but the reward you get from being a recipient and not having to be on dialysis and getting your health back is amazing.
How has your life changed since the transplant?
After transplant, I was able to go back full time. I took a couple months off for to let my body recover, but I wanted to receive the transplant is what has helped me be able to work full time. I'm a mother of two. I stay busy. And again, it's because I received that transplant that I'm able to work full time as a teacher. And I'm back with my students. And again, I work as a teacher and I'm a mom at home and a wife.
What's good and bad about a kidney transplant? A successful transplant can help you return to good health. It won't take hours of treatment time out of your week. You won't need to limit how much fluid you drink. You won't need a peritoneal dialysis catheter or vascular access if you don't already have one. You may feel well and physically stronger, so you can work full time and stay active. And you can take part in most of your usual activities too. Some downsides to a kidney transplant include if your kidney doesn't work well, you may have a long recovery to get back to where you were. You will need to take anti-rejection medications daily for the rest of your life and see a doctor regularly. You will need to drink lots of fluids to help the kidneys stay healthy and may be asked to eat a special diet. You may experience drug side effects like hair growth on your face, hair loss, weight gain, roundness of the face known as moon face, and increased anxiety. You may have to avoid certain contact sport activities where the kidneys would risk being injured. And finally, it could take years to wait for a donor kidney. We know that deciding on a treatment for kidney failure is not an easy choice to make. Today, we hope that you've learned a little bit more about your option for kidney transplant. Congratulations! You've completed the module on kidney transplant. Please check out our website for additional educational modules in this series on kidney failure and treatment options for failing kidneys.